Today, we are going to talk about whether or not booster shots are needed or required with the Pfizer COVID vaccine. Welcome to Dayspring Life and Health Channel. This is Dr. Tim coming to you today with a new update on COVID virus and COVID vaccinations. Don't forget to subscribe to this channel and hit the like button or hit the comment also. And let's get a conversation. If you have any questions or contributions about the subject, please put it in the comment section down below. So let's get to it. So Pfizer, they are seeking for emergency use authorization for a booster shot for the Pfizer COVID vaccine. And when they said that, it has raised some hairs because the government, the CDC, and also the FDA have not made any recommendations as to whether or not booster shots are going to be needed for the Pfizer vaccine for COVID. This comes about as many people are beginning to think that we probably are going to need a booster shot. We probably will need a booster shot for the COVID, and in particular because the Israelis found in their research that many people who had the Pfizer shot had their immunity wane over time. So news from Israel, along with what Pfizer as a company by itself is studying, has brought about the talk about getting a booster shot for Pfizer vaccine for COVID. But we want to talk about whether or not that's going to be necessary. I was listening to Dr. Faucci, and according to Dr. Fauci, it is possible, it is highly probable that booster shots are going to be needed. But until they have received enough data and studied the many millions of people who have already received the vaccine to see if their immunity is waning over time and how much immunity is lost, until data has made that suggestion, he cannot independently say that booster shots are going to be needed, even though it is highly probable, as with many other vaccines. But the other thing to know is that whether or not it's going to be required, for now, as we know it, the 2-dose schedule for the Pfizer shot is enough to give you protection from the coronavirus disease, and in particular protection from the more severe disease. So people who get the shot, even if your immunity wanes along the line, until recommendations are made by the CDC and the FDA as to whether or not you need a booster shot, you can rest assured that you are protected from the severe form of the disease, even if your immune system does not respond as it should be after time or over time with your vaccine. So now, what are booster shots, by the way? In short, many vaccines are available already have required booster shots. Many vaccines, like we can talk about Tdap, Tetanus, Diphtheria, and Pertussis vaccine is required for 10 years. Every 10 years, you will need a booster just to make sure that your immune system is revamped for you to be able to fight it in case you meet it. And especially in women who are pregnant, it is required that they get a booster for tetanus, pertussis, and diphtheria. Pneumococcal vaccine, or vaccines to prevent pneumonia. As children, many people get the vaccination, and you wouldn't need any more doses until you hit about 65 years, when your immunity is waning. In that case, it is recommended that at age 65, if you had pneumonia shot as a kid, which most people do now, you still are recommended to take the booster shot or new pneumonia shot. There is also this category of people who would get pneumonia shot or pneumonia vaccine update and who are not age 65 yet. And those people are people who are immunocompromised. In other words, people who have their immune system not as strong enough due to certain diseases that they already have. And a common one that comes to mind is for people with diabetes, or even people who don't have diabetes but who are smokers. It is recommended that you get pneumonia vaccine or booster, I should say. So booster shots are happening all the time with several vaccines. And the most common one that we all know is the flu shot, the influenza vaccine. Every year, it's become a common practice. You don't even need to ask anybody. You go to your pharmacy, you go to your doctor's office, and you ask them for a flu shot. Even though you had it a year before, it is because the flu virus is constantly mutating. So each year it changes slightly, and we need to revamp the vaccine to make sure that you can fight the new strain out there when the season begins. So that is also another form of booster. So booster shots are common, Ed. And the reason is that as with many other vaccines, over a period, especially in older people, your immune system is not that robust. So when you are given the shot, your body cannot make the antibodies as high as a younger person would be able to make. So over time, it is always wise to assess your antibody levels, or to assess your immune response, so that if it has waned, if it has decreased, then it is only wise that we give a booster shot. With this, if it is recommended for booster shots to be given, the first group of people that may be required to get it is the older folks, the elderly, just because of the reasons I've outlined, because their immune system is not as robust, it's not as strong enough to make the antibodies that is required. And for that matter, if anybody is going to lose immunity to the COVID virus over time from after getting the vaccine, Pfizer vaccine, it would potentially be more severe in older folks. So that is it for the update on COVID vaccine from the Pfizer company. Again, booster shots may be required, but not definitive yet. It will still require more studies to see. Possibly yes, in the future, just like all or several other viral vaccines, viruses usually change, they mutate, they adapt, and even if the immunity doesn't change, even if your immune response doesn't change, if the virus changes or mutates, if the virus mutates and adapts a new form which cannot be detected by your immune system, which was received as a result of the vaccine, then a new vaccine update must be done to be able to catch on to what the new form of virus is. Hope you enjoyed this, and don't forget to hit the like button and subscribe if you haven't already subscribed, or put comments on the bottom there if you have questions, if you want to contribute to the discussion. All right, until I see you next time, beloved, I wish above all things that you prosper and be in health, even as your soul prospers. Thanks.